Panic attacks are periods of intense fear characterized by palpitations, sweating, tremors, and shortness of breath that develop rapidly. It peaks around 10 minutes and then gradually settles or resolves over the next 20 minutes. In extreme stages of panic attack, a patient feels that he is going to die from cardiac or respiratory problems, like sudden severe sharp stabbing. Chest pain may also occur that mimics the MI, but in a panic attack there will be normal ECG and normal examinations. In usual stage of panic attack there will be dizziness, circumoral paresthesia, and tingling, carpopedia spasm, sharp or stabbing chest pain. Patients usually present with tachycardic and tachypneic episodes, and also hyperventilation occur due to hyperventilation. Washout of the carbon dioxide occur that results in respiratory alkalosis, and respiratory alkalosis result in low level of ionic calcium that results in tingling. It is important to rule out the secondary causes of tachycardia, chest pain, or shortness of breath. For this investigation, such as ECG and oxygen saturation and blood glucose are done, and full blood count and kidney function tests and chest x-rays are required if symptoms don't settle in few minutes. So then the management of the panic attacks is given here. General treatment to prevent the further attacks is cognitive behavioral therapy or SSRIs, selective serotonin reuptake inhibitors like the sertraline or fluoxetine. For the panic attacks, for the generalized anxiety disorder, for the social phobia, for three of these, this will be the same management: cognitive behavioral therapy and then the SSRIs. For the acute episode of the panic attack, simple breathing exercises like the breathing through the nose, through the paper bag, or slowing down the breathing or reassurance is all that is needed for the so here the management of the panic disorder is simplified. Treatment before attack: if the treatment is required, management is required before attack, then you will go for the beta blocker, that is propranolol. And if the treatment is required during the attack, then rebreathe into the paper bag. And long-term treatment that is required to prevent the further attack, that will be the same. First line will be the CBT, and second line will be the SSRIs. And then here is the generalized anxiety disorder. Generalized anxiety disorder is actually uncontrollable state, long persisting feeling of anxiety, stress, palpitations, worrying about the everyday events like the money, expenses, and children and jobs. Other features that are not always present, like the tachycardia, palpitation, thinking about everyday events, restlessness, irritability, muscle tension, sweating, breathing difficulties, and chest discomfort, fear of losing control or going crazy. Management of the generalized anxiety disorder includes cognitive behavioral therapy and then the SSRI, sertraline, first line SSRI. It is important to note here that in generalized anxiety disorder the symptoms are long lasting, while in panic attacks the symptoms are short for 10 to 30 minutes. The symptoms in generalized anxiety disorder are present nearly all the time, whereas the symptoms of panic disorder are episodic or sudden. So even if they occur every day, as long as they are sudden episodes, then they will be panic disorder episodes if they are sudden episodes. So here is scenario: a 40-year-old female presents complaining of sweating, palpitation, restlessness almost throughout the day. Then it is generalized anxiety disorder. It's not sudden, so it is generalized anxiety disorder throughout the day. For the last 1 year, she is irritable and has difficulty to concentrate. She thinks about everyday events. She also has occasional chest discomfort and shortness of breath. She reports no triggering events, so it's a generalized anxiety disorder. Another scenario: 29-year-old female feels anxious almost every day throughout the last 6 months. She feels distressed when thinking about the money and her job. She has poor sleep and poor concentration at work. Occasionally she panics and feels that she is about to die. BP is 120/80 and heart rate is 88. Generalized anxiety disorder, because here also she is anxious almost every day, and here is no sudden episode, and she is feeling distressed about the money and job throughout the day, and there is poor concentration. So it's generalized anxiety disorder, and management of generalized anxiety disorder is also CBT and the SSRI if CBT is option. If not given, then SSRI. Here another disorder known as the social phobia, that is social anxiety disorder. In this case, patients try to avoid the situations like the meeting, group events, public speaking, eating in front of people because they are afraid to be criticized or embarrassed. The symptoms are exaggerated. Thus, in the social anxiety disorder or the social phobia, there is a trigger like on being on the stage, meeting someone, meeting others, eating in front of others. Patient fear to be judged or observed or criticized. Remember that panic attacks occur out of the blue. No triggers in the panic attacks. Here is a scenario. 30-year-old woman develops palpitations, dizziness whenever she is in a meeting. She always feels that her fellow workers are judging her. She tries to avoid meetings. And also the fear of being judged. So likely diagnosis: social phobia, social anxiety disorder. Treatment just like the generalized anxiety disorder and like the panic attack. Cognitive behavioral therapy and SSRIs. Another scenario: 40-year-old woman is socially withdrawn, doesn't like to go out of the house, feels distressed whenever she eats in front of strangers, avoid business meetings because she fears that her colleagues would criticize her. So here also the likely